Certainly, here's a mnemonic to help remember some common antibiotic classes, along with their coverage and mechanisms of action. Mnemonic, peptic. 1. Penicillins. 2. Erythromycins, macrolides. 3. Phenicols. 4. Tetracyclines. 5. Isoniazid, used for TB. 6. Cephalosporins. Penicillins. 1. Coverage, broad spectrum, some more focused on gram-positive bacteria. 2. Mechanism, inhibit bacterial cell wall synthesis by interfering with transpeptidation during peptidoglycan formation. Erythromycins, macrolides. 1. Coverage, primarily gram-positive bacteria and atypical organisms. 2. Mechanism, inhibit bacterial protein synthesis by binding to the 50S ribosomal subunit, preventing peptide chain elongation. Phenicols. 1. Coverage, broad spectrum, including some anaerobes. 2. Mechanism, inhibit bacterial protein synthesis by binding to the 50S ribosomal subunit, similar to macrolides. Tetracyclines. 1. Coverage, broad spectrum, including intracellular pathogens. 2. Mechanism, inhibit bacterial protein synthesis by binding to the 30S ribosomal subunit, preventing attachment of tRNA to mRNA ribosome complex. Isoniazid, used for TB. 1. Coverage, Mycobacterium tuberculosis. 2. Mechanism, inhibit mycolic acid synthesis, an essential component of the mycobacterial cell wall. Cephalosporins. 1. Coverage, broad spectrum, with increasing generations having more gram-negative coverage. 2. Mechanism, inhibit bacterial cell wall synthesis by interfering with transpeptidation during peptidoglycan formation, similar to penicillins. Remember that antibiotic resistance can vary, and not all antibiotics within a class have identical coverage. This mnemonic is designed to provide a simplified overview of these antibiotic classes. Always refer to up-to-date medical sources for accurate and detailed information.